Before going into the topic details, I want to bring your attention to the UPSC coaching programs offered by ClearIAS. ClearIAS offers online and offline courses to help candidates get selected for prestigious government services like IAS, IPS, or IFS. ClearIAS, Prelims cum Mains, PCM course, provides a highly effective study plan, well-organized subject-wise videos, study materials, mock exams, and guidance to cover the entire GS syllabus of UPSC CSE Prelims, Mains, and Interview systematically. As a limited period offer, there is a 40% discount on our online courses. Enroll now.
So we are talking about this mission, this scheme actually, that is PRADHAN MANTRI Ayushman Bharat PRADHAN MANTRI Jan Arogya Yojana. So why we are talking about this scheme, which is an old scheme right now, is because it recently appeared, detailed articles were coming in the last week. Why? Because it was actually celebrating, or we can say that 6 years of Ayushman Bharat Yojana was there, and they were listing out the achievements, of course, and that is how the topic actually became relevant in our UPSC perspective. And what is this Ayushman Bharat Yojana is that it is a component of the Jan Arogya Yojana. PM Jan Arogya Yojana is actually a component of the Ayushman Bharat. So Ayushman Bharat is a larger project, and Jan Arogya Yojana is a component of the Ayushman Bharat Yojana scheme actually. And the other scheme is that PMJY, and the next scheme is actually about the wellness centers. Health and wellness centers are the two components of the Ayushman Bharat Yojana. So the main thing is Ayushman Bharat, subsections 2, Jan Arogya Yojana, and health and wellness centers. So this is the topic we have to just briefly understand, the Jan Arogya Yojana, 6 years of that. And that is what we are going to understand. And we have to also understand that this Ayushman Bharat Yojana, it is actually the national health policy which was actually released in 2017. The name given to the policy is Ayushman Bharat. And two components, Jan Arogya Yojana and health and wellness centers. So this is the broad scheme actually. And what this scheme is actually aiming to achieve for, it is the universal health coverage. What is it aiming to achieve for? It is for the universal health coverage. So these kind of terms and terminologies are actually extremely important. Make sure that you mention about this thing in the introduction or the background part itself if a question is actually asked on the topic. Now, what is this thing called Ayushman Bharat Jan Arogya Yojana, which is actually celebrating 6 years? The number one thing is actually, it is actually the largest, health insurance scheme in the world. So that is the first thing. It is actually the largest insurance scheme in the world related to the health sector. That is the most important aspect of the scheme itself. That itself shows how much big the scheme is. One thing. And then who is actually implementing it, or who is actually the main agency regarding it? Is definitely the Ministry of Health and Family Welfare. So these are not very important points, but you can just briefly understand the comments, what do you say, logical points actually. And then what is this particular thing is actually all about? It is actually about cashless, or we can say when the insurance is actually being done, it is actually, we can say that it is actually the cashless hospital cost. You can say hospital, expenses are actually cashless. All these things, all this insurance cover is actually done cashless. If a patient covered under the scheme, you don't have to give money to the hospital or to the hospital system individually in a cash manner. All these things are actually done in a cashless manner, part of the Digital India scheme also. So whenever there is a Digital India question, something like that, you can mention these schemes also, which are in collaborative nature. And then what is actually happening is that what the families are actually getting, they are getting somewhere close to 5 lakh rupees per year per family. That is what the scheme is actually all about. So the 5 lakh rupees per family, and every year they will be getting 5 lakh rupees of insurance, health insurance, every family. So that is actually the scheme, and that is why India it is actually considered to be the world's largest health insurance scheme. Now, we can create statements. So if I'm creating a statement like that, consider the following statements. PM Jan Arogya Yojana is actually a scheme which provides health insurance coverage for the primary sector. Is it right or wrong? It is actually wrong. There is no primary sector coverage. It is actually only secondary as well as tertiary coverage. Secondary means that if you are actually going to some small clinics, etc., some kind of primary clinics, etc., if you are having some kind of fever or some kind of diseases, which the doctor says that you need more kind of treatment. So he or she will refer it. That doctor will refer us. So we'll go to next level of hospital. That is the secondary level. So there will be some kind of small specialist doctors will be there. So they will treat us. And if they will also find that, okay, some kind of more treatments or surgeries, more diagnosis, things will be there, super specialty things are required, we will go to tertiary care. So this scheme is applicable not in the primary sector, but in the secondary tertiary care sector alone. That is one prelim statement we can say. They can simply create a statement out of that. Now, they have actually definitely, impaneled certain kinds of hospitals. That is, certain hospitals come into the scheme, Jan Arogya Yojana, and they say that, okay, we agree to the particular insurance scheme. And we can create another statement. Only only public hospitals are actually impaneled. Normally, we think that it is the government scheme, so it is applicable only to the government hospitals. No, it is not like that. All the government hospitals, all the public hospitals, plus certain private hospitals are also impaneled in the scheme. So both empanel means both public plus private hospitals are also included. That is another point, UPSC perspective point. The next thing is that while we are actually in the hospital, okay, we'll get the insurance coverage. But what about before and after the hospital? What about the surgeries? Other than the normal treatment, what about the surgeries? What about the medicines also? So we have to understand that both the pre-hospitalization and the post-hospitalization is also covered under the scheme. And when we are actually trying to elaborate, we have to understand that 3 days of pre-hospitalization. So before admitting to the hospital, all the medical expenses 3 days prior to the hospitalization. So 3 days of pre-hospitalization. And what about post-hospitalization? 15 days of post-hospitalization is actually also covered under the scheme. So 3 days before hospital, the hospital cost plus 15 days of post-hospital cost is all covered under the particular scheme. Along with that, not just the normal treatment methods, we have to also understand that all the diagnosis, all the medicines, and if you say surgeries, etc., all these things will be covered under the scheme. So everything, it is a comprehensive package, we can say. I hope it is actually, you understood the thing. And what is the target actually? Just like the last slide actually mentioned, it is actually the Press Information Bureau page only. And it is saying that it is actually enhancing the healthcare access for 12 crore families with 5 lakh coverage. So what is the target we are actually looking at? We are actually looking at the target of 12 crore families. So what do we mean by 12 crore families? They are estimating it to be somewhere close to 55 crore people, 55 crore beneficiaries. So that is the target which they are saying. And this 55 crore, that is why they are saying this is the largest insurance scheme. That much number of people are benefited. So this is actually the entire scheme is actually all about. I hope it is actually understood the thing. And recently also we have to understood one other current affair aspect inside this topic is that the cabinet committee, the cabinet actually approved this PM Jan Arogya Yojana to be extended. So we already mentioned that it is actually applicable to certain categories of people only. We'll come to that. And they actually extended this scheme to all the senior citizens of 70 years and above. So if you are actually from different backgrounds, different categories, different places, etc., like that, once you cross 70 years, it will be applicable for everyone. That is actually one recent amendment to this particular yojana, to this particular scheme also. And so which means that if you are implementing this thing, extra 5.4 crore families will be benefited. So in addition to that 5.4 crore families will extra be benefited. Have you ever thought about the concept of out-of-pocket expenditure? That is one important word, out-of-pocket expenditure. Out-of-pocket expenditure means it will create a hole in your pocket. That is the term which is used in English. Create a hole in your pocket, which means that you're spending unnecessarily. I'm not saying that it is unnecessary, but you're spending it unnecessarily because of an unwanted disease. So you're already in kind of on the lines of poverty. So when you're actually getting affected with certain kinds of diseases, like cancer or something like that, you have to spend on that. You don't have that much of public support actually. You may have to go for super specialty hospitals, maybe in the private sector where you have to depend on such hospitals, etc., because of the lack of public sector hospitals, which means that you have to spend lakhs and lakhs of rupees. Already under poverty, you will be under extreme poverty because of these kind of diseases. So that is what we call as out-of-pocket expenditures, which will create a hole in your pocket. Right. That is one important aspect which you have to understand. And you also know that all the different kinds of hospitals, different private hospitals there are definitely good hospitals, but there are certain kind of hospitals which are minting money out of it. If you just go to the hospital for some kind of cold, fever, something like that, they will give you innumerable number of diagnosis, tests, scan, etc. And you have to spend that much number of money for different kind of diagnosis. Rather than, addressing your issue, you will be spending more amount of money. So these kind of issues, these kind of unethical practices are also, we have to discuss that also in the healthcare sector. That is why PM Jan Arogya Yojana is one important thing, because it gives that kind of protection or coverage to the needy actually. And then what are the last thing about this scheme is that about the achievements of the scheme. So what are the achievements which is actually discussed when the 60 years anniversary was discussing, is that they're having a huge coverage. And what is the coverage which they are saying? They are saying a coverage of something like 35.4 crore Ayushman Bharat cards have been issued. So they are saying that much number of people have got into the system. They have been issued that much number of individual identity cards will be there, that I am actually eligible for the insurance. So that much number of cards, 35.4 crore number of cards have been issued. So this scheme is almost a successful scheme. That is one important point. And when we think about this much number of cards, they're also saying is that the number of the percentage of women who hold these kind of cards is somewhere close to 49%. So out of this much number, 35.4 crores, almost 50% of the card holders are actually women. So the scheme says that it is actually gender friendly, or you can say that it is actually woman friendly also. That is the second point. And the next thing is actually about, they're talking about the network. They're talking about, we already told that all the government hospitals will be there, and certain private hospitals will also be empaneled. So we normally have a doubt that, okay, will the private hospitals come for that? Because it is actually helping the poor. Are they not profit minded? But we can say that there are private hospitals also. They are saying it is an achievement also, that it is actually a huge network. And they're saying is that there is somewhere close to 30,000 plus hospitals are overall empaneled. That much number of hospitals have this kind of system. That is the Ayushman Bharat system is there, in which out of this 30,000, almost 17,000 hospitals are actually coming from the public sector, and rest of the remaining, that is somewhere close to 13,500 hospitals are actually from the private sector. So this combined together makes somewhere close to 30,000 hospitals which has this scheme under operation. So it is a huge network, definitely. That is another point. So how are the beneficiaries actually identified? What is the classification? It is actually based on the SECC, that is the Socio-Economic Caste Census of 2011. There is a census that actually happened, and it is not the official census of Government of India. It is actually a Socio-Economic Caste Census, separate census, and it gives you a brief idea about how the different people, how the different communities, how the different castes, etc., they are actually faring. And according to the census, from the census, actually, they identify the beneficiaries under the Jan Arogya Yojana. So how they identify? If they can create a statement. The basic people are actually identified by the Gram Panchayat, or the people are actually identified by the census of 2011, etc., like that. But this is the word socio-economic caste census of 2011, right? Because we don't have a census even now in 2021, this is one of the important documents from where we get important data. So it is very relevant. And then next thing is actually about the funding actually. So when we talk about the funding and the expenses also, we can roughly say that in 2023, last year, the scheme is actually improving really good. So once the scheme was actually established, and it is actually the 6th year, but in the last year, they have got a lot of different improvements also. So we are saying that till now, there is actually, just before funding, 6.11 crore admissions were actually happened under the scheme so far, and the government has already funded somewhere close to 75,000 crore rupees already in the scheme. That is what the achievement list is actually saying. They are saying that, yes, we are funding really good. We are promoting the scheme, and it is actually improving. So that much number, that much 75,000 crore rupees have been already spent. And in the 75,000 crore rupees, almost 6.11 crore admissions were already there. So that much number of people benefited. And regarding the funding of the scheme, like any other scheme, it is a central sponsored. It is a centrally sponsored scheme, which means that it is actually sponsored with the center and state together, or the center alone. Center and state. So it is actually centrally sponsored scheme. So we know the numbers. Right? What is the number actually? The central government, if it is a centrally sponsored scheme, 60-40 is the normal share. 60 by the center, 40 by the state. Right. And there are certain times in which it is actually 90:10. So when it is actually 90:10 with certain states, for example, Northeast India, the states in the Northeast Indian region, that is one region where the central government funds almost 90% of the money of the scheme, implementation money. And then not just the Northeast India, actually, there are certain kind of other places, for example, the Jammu and other Kashmir region, the Ladakh region, of course, the Himachal Pradesh, the Uttarakhand region, that is mainly the mountainous region, Himalayan belt. So all these states have got the advantage because they have to spend that 10% of the money. Rest 90% will be spent by the government of India. And all the other UTs, for example, all the UTs have to be, they don't have to spend any money. The central government will fund their money. The UTs without legislative assemblies. That is the point. The UTs without legislative assemblies. Which are the UTs with legislative assemblies? Are there any union territories with legislative assemblies? Delhi is definitely one. Pondicherry is definitely one. Jammu Kashmir is now it is actually Ladakh and Jammu Kashmir. Now the election is actually it is still under rule, right? There is no assembly there, right? Going to happen, yes. When it is, yes, you're actually right. Elections are definitely happening. That is another current affair. So that is another point. So when the Jammu Kashmir assembly is also coming, that also will come under this category. That is the point. So without the legislative assembly, always categories like that, UTs, Lakshadweep cannot be compared, or Andaman cannot be compared with Puducherry or Delhi, actually, because these last two have legislative assemblies of their own. So this is the thing which we have to understand about the patterns. And last but not the least, we have to also keep in mind who is the implementing agency. It is the National Health Authority. So a specialized dedicated agency is actually created. That is the, what happened here? The National Health Authority. Right. All under the Ministry of Health and Family Welfare. So this is actually, the scheme is actually all about what is the scheme, how the funding pattern is there, how the beneficiaries are actually identified, what is the achievement, has the scheme achieved anything, what is the basic data which we can extract from the achievement data of the 6th anniversary. So this is what we actually discuss right now.